Hello, my name is Glenn Mauser. I want to talk to you today about the product that I'm trying to get funded. There's a problem with blood issues around the world. Blood shortages, bloodborne pathogens, spoiled blood, and for religious reasons, some people take no blood. So I've come up with a solution that would replace blood for acute trauma issues and for some possible chronic issues. But for years, substitutes have been tried. There's been all kinds of issues that have come up with them. Toxic issues, some of them just didn't work. And another problem was they were either human or animal-derived byproducts that were in it. I have that answer and a solution to that, and it has no animal or human derivations. It'd be marketed as an expander rather than a blood substitute. And the reason for this is the FDA already has the CFRs in place to be able to address that. So we keep it as a saline plasma expander. Perhaps a few medical device approvals might be needed. I'm not certain of that. But I'm going to go through some of the processes, and this will all be done in phases. And so this is basically the first phase of it, as far as funding, the first part of the funding. There's several profit centers of this project. Each one in itself has tremendous potential. So I'm going to help define the big picture overlook right now to help you understand what that money part of this is. It's about $100 billion a year globally industry, just the blood alone. It's huge. So we're going to get it into several areas of profit centers. Each one of these is patentable or patent pending in some way or another. First of all is the blood expander itself, a product that I've developed over 15 years of work on this thing. And this is no human or animal derivations in it. It's got stem cells in it, all kinds of special plant extracts that actually give off oxygen. So one would just be that product alone, the plasma expander. Another one would be a freeze-dried blood. This would be primarily for military, but new enrollees or boot camp attendees for the military would be required to give 2 or 3 units of their own blood, and through a special process which isn't developed yet, but it'll be developed with someone who's already dealing with blood and freeze drying or lyophilization. They would freeze dry the soldier's blood and be put into a frangible IV bag. Now the frangible part means fragile and have a seal in there. So imagine the bag, a large bag, but it'd be the bottom portion would be the soldier's own dried blood. So then it would be, the top part wouldn't have anything in it. So the soldier would carry this with them, and in the event they should get harmed on the battlefield or in battle or wherever they are, they get hurt, the field medic would assess the situation, determine if just saline solution would be all right, or does a soldier actually need its own blood. So if he needs his own blood, then they would revert to the product that the medic would be carrying, and there'd be large cans of in stainless steel cans of my blood expander. And they would just pour, and they would be large. I mean, it would handle many units, but they would put a certain amount, 500 milliliters, 1 unit of liquid into the bag, fragile bag, seal it, twist it, shake it a little bit, and it's ready to go into the soldier's own body, his own blood, made with this life-giving product of the expander. So it really becomes quite functional then. But if the field medic should determine that the soldier doesn't really need his own blood at this point, then just as an expander, then he can just use the expander I have already. It's in the large containers. They just dispense it into IV bags. So there's two profit centers: the plasma expander, the freeze-dried blood, and then the third one would be, or could be, the ID of this product. It's some sort of a software and hardware system where from the time that medic, the medic assesses and makes sure that the bag that the soldier is carrying of the dried blood matches up with that person's own ID tag, that is in fact that person. So there's an entire software identification situation that would be developed along with this. And part of that, the hardware, would be a scanner system, another potential patented thing. And then, of course, the delivery bag itself is either patentable or already has been patented. And that would be patentable. So far there are several. And then there are going to be many medical patents, new products, new concepts, particularly in the stem cell area, which this will has a lot of stem cells in there. The stem cells that we'll be using will be non-animal or non-human derived. They'll be plant derived, but they're unprogrammed stem cells, and we will develop that system and patent it. It'll be explants, derivations. We'll do our own callus growing and stem cell designing and culturing, and that'll be part of this process. And these are all patentable. And all these things is what makes this thing really, really go, is that it's going to be very powerful in what it does, plus all of the other patentable profit area products. There will be a lot of lab work that needs to be done, and that's what a lot of this money will go towards, is the design and starting the lab work so we can get it down to a demonstrable level. Now, we may not be able to demonstrate it in humans right off, but we can start it certainly on something else perhaps, and find out how well it functions then. Then, depending on how well it goes, we will license this, perhaps all or some of the concepts, to other companies, major manufacturers, and or distributors. And this is how we will get it going, get it to a demonstrable level, a workable product, all the different facets of it. So I really need to get this going with your help and funding project. Thank you.